Welcome back to another video. This is going to be the third video in a three-part series that I am doing for my orthopedic specialist certification. If you haven't checked out the other two on exercise during pregnancy or manual interventions for pain during pregnancy, then look at my previous videos I've uploaded. This one will be directed on pelvic floor rehab for urinary incontinence and how to approach the topic with your patients. This topic will also be geared again towards mainly healthcare professionals. So if there's any terminology or information that I provide that you aren't familiar with, then check the description box for links and my references for the research I'm presenting today. And always feel free to ask questions in the description box. But if you're interested in knowing more, then keep watching. So to discuss pelvic floor rehab during pregnancy for urinary incontinence perspective, we first have to define what urinary incontinence is. A lot of people might associate urinary incontinence to being in the bed, being in a diaper, things like that, but it has a much simpler and broader definition, which is just any type of urinary or bowel leakage outside of your control. This can be caused by just general weakness of the sphincter. Now we're going to get into talking about the types of incontinence when you're looking at urinary incontinence. The first one is urge incontinence. And this is when leakage occurs when you have the overwhelming urge to urinate. And it's typically associated with pelvic floor spasm or incompetence. Next we have stress incontinence, which is typically brought on when you have leakage with coughing, sneezing, laughing. Mixed incontinence is urge and stress incontinence having some combination of the two. Overflow incontinence is going to be the result of incomplete voiding of your bladder. And functional incontinence is one of the more common ones that you might see maybe post-op in the surgical department. It results from having a patient that isn't able to get to the bathroom in time for whatever reason. So that could be they just had a leg amputation and they're not able to move around as much, and that's why it's functional, because it has to do with their ability to move. Now when you're beginning to address pelvic floor rehab for your patient that is pregnant or otherwise just general population, you have to know how to approach them and how to ask these questions. Now that we know what types of urinary incontinence we have and what to look out for, you want to know how to make it a safe place to phrase it to your patient. First, you might want to ask them if they've had any trouble getting to the bathroom on time or had any leakage in general, instead of using the word incontinence, which can be a little scary at times. For your postpartum mothers, you want to ask about their current pain levels, their past deliveries, and their journey to healing after their pregnancy. You can also discuss their voiding, their bowel movement, and if they're having to strain or not while using the restroom. Some objective testing that you can introduce is looking at the quality of their breathing, their transverse abdominis recruitment, and their general pelvic floor recruitment. During pregnancy, we know as the baby grows, the organs may shift. So this can, as a result, compromise the movement of the diaphragmatic pattern. So after we've done our objective testing and questioning for our postpartum mothers, one easy way you can start with treatment is with diaphragmatic breathing. To address this, you can teach them about breathing through their diaphragm, making sure they're not straining or performing Valsalva maneuver while they're on the toilet trying to void their bladder. You can also discuss pain management and cramps, and even if they have any type of scar tissue with your postpartum mothers. In general, diaphragmatic breathing is really important when it comes to pelvic floor rehab, especially with your postpartum mothers, just because everybody thinks Kegels whenever they think pelvic floor rehab, but that's not always the case. As we discussed in urge incontinence, you can have this be manifested because of pelvic floor spasms. So teaching them down training with diaphragmatic breathing and other techniques can actually be really important. For education you can give your patient on this has to do with bladder retraining. You can educate the patient on voiding too often, voiding too little, or even voiding prematurely. Lifestyle habits is going to be really important with this concept as well when you talk about education, because it's going to make a big difference for the patient's hydration, their constipation, their toileting position. And some examples with that have to do if they are drinking too much alcohol or coffee, which can be diuretics, that is going to influence their bladder movements and when they go to the bathroom. Their toileting positions can be as simple as changing their feet positioning to giving them elevation, giving them a squatty potty device to help with the natural shape of the colon, and making it easier to omit a bowel or bladder movement, and making it easier to have a bowel movement. And conversations about healthy fiber and healthy eating habits can also make a huge impact with education when it comes to bladder incontinence and just general gut health. When having a conversation with postpartum mothers, it is also important to have options as far as devices and information that you can present to them. An abdominal binder is one device that can be helpful with promoting abdominal healing and preventing diastasis recti in your patient. Overall, a few red flags to consider in the conversation of referring your patient to a specialist, a urologist, a pelvic floor therapist, are if they have hematuria, if they have obstructive symptoms, or if they have recurrent urinary tract infections, to name a few. So those are just a few of the high points of what to consider when you have a patient that does have urinary incontinence, and especially if it is a postpartum mother. A few of the takeaway key points to consider is that Kegels aren't the answer to everything. Sometimes you need down training. You want to make sure you're giving the patient proper education, and I'll leave some of that information in the description box for you to have access to as well. And in general, just knowing how to approach the conversation with the patient, because it can be a shy topic to discuss and it can have a lot of common misconceptions. So overall, I hope this information was helpful. Check out the information box if you have any questions, or if you want to check out some of the resources that I'm going to provide. And if you have any questions, as always, just leave a comment or question for me and I'll be happy to answer. But I hope I see you guys in the next one, and thank you so much. Bye.